Okay, so today we're diving deep into OCD.
Yeah.
And we're going way beyond just, liking things to be tidy.
Right.
You've given us this article, and it really gets into, the real struggles.
Absolutely.
And how we can all be more supportive.
Yeah, and I think what's so interesting about this article in particular is how it really highlights that OCD exists on a spectrum.
Mm-hmm.
It's not a one-size-fits-all.
Right.
And it reminds us that everyone's experience is unique, and it's about way more than just those little personality quirks we might all have.
So let's break it down, because I think we hear ACD and it gets thrown around a lot. What actually is it?
Right. So this article does a really good job at clearly explaining that.
Okay.
And it really emphasizes the difference between those everyday quirks that I think we all have to some degree.
Right.
And you know what is actually clinically significant OCD? Like, it's the difference between, say, preferring your pantry to be organized and feeling this overwhelming sense of dread.
Right.
If a single spice is out of place to the point where it disrupts your entire day.
Wow.
OCD is about these intrusive, unwanted thoughts, and these are called obsessions.
Okay.
That then fuel these repetitive behaviors, which are called compulsions.
Okay.
And they can be very difficult to control.
So it's not just about liking things a certain way.
Right.
It's about those thoughts and behaviors reaching a point where they really impact your life.
Exactly. And, this article really gets into some of the common obsessions we're talking about, things like fear of contamination anxieties about causing harm and overwhelming need for order. Like, for example, imagine feeling the need to sanitize each grocery item for hours before putting them away.
Oh, wow.
Driven by this intense fear of contamination.
Yeah.
So you can just imagine how debilitating that can be.
Wow. Yeah, that really paints a picture
Yeah.
of how intense those obsessions can be.
Right.
And then it makes those compulsions, like you were talking about, those repetitive behaviors, almost seem like a response to that intensity.
Exactly. It's like the compulsions, things like
Yeah.
excessive cleaning, endless checking, arranging things,
Right.
just so
Yeah.
they kind of offer this temporary escape hatch
Yeah.
from the anxiety that those obsessions are creating.
Right.
But, and this is the challenging part, it's a bit of a vicious cycle.
Because the relief is only temporary, right?
Exactly.
So you almost have to keep doing it more and more.
Precisely. Yeah, you hit the nail on the head.
And so I'm guessing
Yeah.
that this is where this idea of OCD existing on a spectrum comes in.
Absolutely. And this article highlights that.
Okay.
OCD looks different for everybody.
Right.
For some, it might be these very mild anxieties they can kind of manage.
Yeah.
But for others, it can be completely debilitating, taking over their lives.
So it's like you wouldn't tell someone with a broken leg to just walk it off.
Exactly.
Right.
Exactly. So we need to approach OCD with that same sort of understanding that it's a real condition.
Absolutely.
With very real impacts.
It is.
So where does this come from?
Yeah.
What causes OCD?
That's a great question. And it's one that researchers are still trying to fully unravel.
Right. But the article delves into this nature versus nurture debate.
Right.
And the reality is that for many mental health conditions, OCD included, it's likely this complex interplay of both.
Okay, so let's talk about the nature part first.
Yeah.
So genetics can play a role.
They can.
Does that mean if my parents have OCD, am I guaranteed to have it too?
Well, no. It's not as simple as like a direct inheritance. It's more nuanced than that, a family history of OCD might increase someone's susceptibility to developing the condition, but it's not a guaranteed outcome.
Okay.
Think of it more like, certain genes might make someone more sensitive or reactive to certain triggers in their environment.
Gotcha.
Like, it's kind of like having a certain set of blueprints.
Yeah.
Those blueprints don't dictate the entire building, but they can influence its form and function.
Okay.
You know what I mean?
Yeah, that makes sense. So going back to that nurture aspect,
Right.
what kinds of environmental factors are we talking about here?
Well, the article points to things like stressful life events.
Okay.
Job lost death of a loved one.
Mm-hmm.
Even positive changes like getting married or having a child.
Right.
These can all be challenging for anyone to navigate.
Sure.
But for someone with a predisposition to OCD, these events might act as a trigger.
It's like life throws these curveballs.
Yeah.
And depending on, how your brain is wired,
Right.
it might have a harder time catching them than someone else.
And then, of course, there's the role of brain chemistry.
Okay.
This article specifically talks about the neurotransmitter serotonin, which plays a big part in regulating mood and anxiety.
And is this where medication comes in?
Yeah.
Because I know some antidepressants work by impacting serotonin levels.
You're right on the money.
Okay.
The article explains how, for some individuals with OCD medication, like SSRIs, which are selective serotonin reuptake inhibitors, can be helpful.
Okay.
They work by essentially increasing the availability of serotonin in the brain,
Right.
which can then help regulate those obsessive thoughts and compulsive urges.
So it's almost like the medication can help quiet the noise a bit,
Yeah.
and then therapy can give you the tools to manage it sort of long term.
That's a great way to think about it.
Okay.
It's about finding that right combination of treatments that work best for each individual. And one thing that this article really emphasizes alongside therapy and medication is the importance of support networks.
Okay, so are we talking like friends, family support groups, online communities?
Absolutely.
Okay.
All of that.
Yeah.
You know, the article talks about how isolating OCD can be.
Right.
So having that strong support system that can make people who understand what you're going through
Yeah.
is so crucial.
Yeah. You don't want to feel alone in this.
Exactly.
Yeah.
Knowing you're not alone can make a huge difference.
Absolutely.
Yeah.
It's like having a team in your corner, to cheer you on and understand that, like,
Absolutely.
this is a marathon, not a sprint.
100%.
This article doesn't just focus on individual experiences, though, right?
Right.
It also hints at the bigger picture, like how OCD plays out on a societal level.
You're picking up on a really crucial point.
Okay.
You know, while the article delves into these personal stories and experiences,
Yeah.
it also prompts us to consider this broader societal impact.
Okay.
How can we as a society
Yeah.
foster greater understanding and reduce the stigma that often surrounds mental health conditions like OCD?
Because let's be real, there's still a lot of shame
Oh, absolutely.
and misunderstanding surrounding mental health.
Yeah.
People might be hesitant to talk about it,
Right?
to seek help,
Yeah.
because they're afraid of being judged or
Yeah.
misunderstood.
And that silence, I think,
Yeah.
only makes things harder.
Right.
Think about it. The more we talk openly about OCD, the more we educate ourselves and challenge these harmful stereotypes. The closer we get to creating a society where people feel safe and supported, seeking help.
Absolutely. It's like we're almost conditioned to think about mental health as something that should be whispered about.
Right.
When really it's like
Right.
we should be talking about it as openly and honestly as we talk about,
Absolutely.
any other health concern.
100%.
Like, it's okay to not be okay.
Yeah.
And it's okay to talk about it.
And to reach out for support.
Yes, exactly.
You don't have to suffer in silence.
And this article does, I think, a really good job of showing how important
Yeah.
that compassion is, and not just for individuals with OCD, but, for everyone around them.
Their families, their friends,
Yeah.
their coworkers.
And it made me think about the role of those support networks, and not just in terms of, friends and family, but maybe even workplaces and schools.
Oh, for sure.
Like, imagine, if you will,
Yeah.
a workplace that understood OCD
Right.
and was super accommodating.
Yeah, where someone could comfortably ask for what they need
Exactly.
without feeling like they have to hide who they are.
Yes. And without feeling ashamed
Exactly.
to have to, disclose that.
100%.
Yeah.
Think about schools
Yeah.
educating students about mental health.
Right. From a young age.
Yes. Fostering a culture of empathy and understanding.
Yeah. Because it all comes back to that idea of, changing the narrative, right?
Right.
Moving away from the stigma and the silence towards, you know, a place of openness and support.
Openness and support. That's what it's all about. And those changes might seem small, but they can have this incredible ripple effect.
Yeah, totally.
Yeah.
One conversation.
Yeah.
One, act of understanding
Absolutely.
can make a world of difference.
100%
Yeah.
in someone's life.
So for our listeners out there who are ready to take that next step,
Yeah.
what would you say is the most important thing they can take away from this deep dive?
I think it's this, OCD is a real condition. It's complex, and it impacts people in very, very diverse ways.
Yeah.
So let's all approach it with knowledge,
Yes.
with empathy, and with a commitment to creating a world where everyone feels seen, heard, and supported.
It's about recognizing that, someone's struggles are not their fault.
Exactly.
And that support on both an individual and a societal level
100%.
can make all the difference.
It really can.
So if you are inspired to learn more about OCD or explore ways to, be an ally to someone who's struggling,
Yeah.
There are some really fantastic resources available, and we will be sure to link to some of those in our show notes.
Awesome.
So thanks for joining us on this deep dive, and until next time, keep asking questions, keep learning, and keep those important conversations going.